Hi, my name is Neve, and I shadowed at Seton in the fall semester, and for the spring semester, I was at Schoolhouse Pediatrics shadowing under a physician assistant.
Hi, I'm Jesse, and I also shadowed at Seton for the fall semester, and for the spring semester, I shadowed at Results Physiotherapy under some PTs and a PTA. At Seton every day, we would each go to our different department following our map, and we would ask for the charge nurse of each department, and generally they would assign us a nurse to shadow for the day.
So we're going to talk about our three favorite areas or departments that we shadowed at Seton. I really liked radiology just because you get to see real procedures happen, and for one of mine, a patient was still awake while the procedure was occurring, and she requested a certain kind of music. I don't remember. Everyone in the imaging room was really nice and wanted to talk and explain everything to you, which is really cool. I also like neurology because it was interesting to see that some of the patients had to be restrained to their beds, and hearing some of the stories from the nurses about the things they say and the things they do, and how they refuse medication was kind of interesting. I also liked cardiac telemetry solely because all the nurses and patient care technicians and everyone I talked to and interacted with was super nice. And they involved me in things and explained the EKG that they did on one of the patients. It was really cool. I like cardiac telemetry.
For my top three favorite departments for Seton, there was a tie for third place between postpartum care and post-anesthesia care. And I liked postpartum a lot because it was really cool seeing all the families with their newborn babies and how happy they were. And I also spent a lot of my day with postpartum in the infirmary, and it was really cool seeing what all the nurses and babies had to do right after they were born. And I like post anesthesia care because it was kind of funny seeing all the patients a little out of it and waking up all groggy and confused. And the nurses in that unit were really helpful, and they told me all the tests they were doing and let me know everything that was happening. And my second favorite department was radiology. Like Neve said, you can see procedures and surgeries happen live, which is super cool. And all the radiologists and nurses in the imaging room, they explain everything that's going on, and they're super helpful and nice, and they just tell you everything that's happening, so you learn a lot. And my favorite department was endoscopy because like radiology, you can see live procedures happen, and with endoscopy, we were in the procedure room with them during the procedure right next to them, and it's super cool because you can see on screens they stick a little tube down their throat with a camera, and you see everything going on inside them, and you find all the little problems and polyps. And the doctor that was doing it when I was there, Dr. Tao, he was super awesome and cool and nice and funny, and he was cracking jokes the whole time, and he was including me with everything and telling me what was going on. And it was just a really cool experience. And I got to see 2 procedures during my endoscopy day.
So we're also going to share 3 moments at our sites, our individual sites for the spring that were really interesting. For me, there was a day when all the patients that came in for a sick visit at the pediatrician office left with a hand-foot-mouth diagnosis, which likely occurred from it was in a bunch of little kids, so it likely occurred from daycares, dense classrooms, and stuff like that. And it was cool to see the increase in those diagnoses over the next couple weeks after having that initial, outbreak. Second most interesting thing that I saw happen was when the PA that I'm shadowing suspected that a patient who had an irritated eye had just scratched it with something, whether it was their finger or a foreign object. And so she used this fluorescent dye that's a dark orange, and she put it on the eye and used a blue light to see if there was any scratch on the cornea, which is the outer layer of the eye. And she did discover a tiny scratch, and so they were able to send that patient home with just whatever over-the-counter stuff they needed. Another interesting moment was when I got to see the back of someone's throat after their tonsils were removed. It's all gray and white because the tissue is regrowing and it's new. But after some healing, it'll be pink after a while, which is cool.
My first most interesting moment, or the most interesting treatment that I saw, was dry needling with electric point stimulation. And dry needling is where they stick needles into you, and it's supposed to relax the muscles and relieve tension. And the electric point stimulation did the same thing. It sends little electric shots and it relieves tension. And it's really cool because it makes like the muscles twitch and you can see it, and it's super funky. And the most interesting story from like a patient that I heard was there was one patient that came in and he was like super buff and he's doing all his rehab exercises, and I'm wondering like why they are looking difficult for him, because they don't look like exercises that would normally be difficult for someone like him. So I asked him if he would like tell me why he was there, and I was expecting like a torn ligament or something, but he told me he got shot twice. So that's why he was at physical therapy. And then my third most interesting, or is more just like my favorite experience, it was when I was with one of the PTs and she had a patient that was like a severe fall risk, and I went through the tests, the fall risk tests with her, and the PT had me basically like guess what she would give her patient on like each question for the fall risk, and it was really cool. And the patient actually was better off. They were like a medium high fall risk afterwards instead of a severe fall risk.
So the last thing we're really going to go over is how you may be nervous for your first day at your site. With SEAT in the hospital is really big, and you're left with only a map to find out where you need to go, and you have to ask questions. But you gain confidence through this, and you get to meet a bunch of people, and it's a really good experience overall. For individual sites, it can be scary to just show up to a random place and talk to people you've never met before. But that's just part of the process, and you'll get to know these people, and I really enjoyed my site and all the people there. And it gets to be really fun.
My last piece of advice is, unless you like completely have your career set out for you already, or you just love your site so much that you could never leave it, I think it would be beneficial to try to go to multiple different sites, because you'll get a variety of experiences and you never know what you might like. So I think you'll get from this practicum what you put into it.